Hello everyone, welcome to this lecture from CyberMD. Today we'll be discussing pressure volume loops in pathologic states as they apply to the USMLE Step 1 exam. First, let's talk about the pressure volume loop. This is a graphical representation of the relationship between the pressure within the heart and the volume of the blood in the heart at different points in the cardiac cycle. This loop is divided into 5 main phases: isovolumetric contraction, systolic ejection, isovolumetric relaxation, rapid filling, and reduced filling. As we discussed in an earlier lecture, the loop can be affected by several factors, including contractility, preload, and afterload. It can also be affected by pathologic states, which is the focus of this lecture. So let's dive in. Aortic stenosis and aortic regurgitation, as well as mitral stenosis and mitral regurgitation, are 4 different types of valvular heart diseases that can have an effect on the pressure volume loop. Aortic stenosis is a condition in which the aortic valve, which is the valve that separates the left ventricle and the aorta, becomes stiff and the lumen becomes narrow. As a result, the left ventricle has to work harder to pump blood through the narrowed valve. This increase in afterload leads to a shift in the pressure volume loop upwards and to the right. The end result is a decrease in stroke volume, or the amount of blood pumped out of the heart with each contraction. Additionally, the increased myocardial workload can result in an increase in myocardial oxygen consumption. On the other hand, aortic regurgitation is a condition in which the aortic valve does not close properly, allowing blood to flow back into the left ventricle. This increases the preload on the left ventricle and causes an increase in end-diastolic volume, or the amount of blood within the ventricles at the end of diastole. This increase in preload leads to an upward and rightward shift of the pressure volume loop, albeit in a different manner than that seen in aortic stenosis. Additionally, it leads to an increase in stroke volume secondary to increase in volume of the left ventricle after the backflow occurs. There is a loss of a true isovolumetric contraction due to the backflow. Mitral stenosis is a condition in which the mitral valve, which is the valve that separates the left atrium and left ventricle, becomes narrowed. Similar to the aortic stenosis situation, the left atrium has to work harder to pump blood through the narrowed valve, leading to an increase in left atrial pressure and shift in the pressure volume loop downward and to the left, resulting in a decrease in stroke volume. Finally, mitral regurgitation is a condition in which the mitral valve does not close properly, allowing blood to flow back into the left atrium. This increases the preload on the left ventricle because of the extra blood that stays in the heart and causes an increase in end-diastolic volume, leading to a shift in the pressure volume loop upward and to the right, resulting in an increase in stroke volume. There is a loss of true isovolumetric contraction, however, due to the backflow. It's important to note that these effects on the pressure volume loops can ultimately lead to symptoms such as shortness of breath, fatigue, chest pain, and even heart failure. They can also lead to serious long-term consequences such as damage to the heart muscles and even death. In order to prevent these consequences, early diagnosis and appropriate treatment are important. In summary, the pressure volume loop is divided into 5 main phases: isovolumetric contraction, systolic ejection, isovolumetric relaxation, rapid filling, and reduced filling. It can be affected by contractility, preload, and afterload. The loop also changes in pathologic states such as aortic stenosis, aortic regurgitation, mitral stenosis, and mitral regurgitation. Thanks so much for watching, and remember to subscribe to our content.